Welcome back to McLaren Port Huron's Today's Health Program. Today we're talking about trauma services, and joining me now is board-certified general surgeon and medical director of McLaren Port Huron's Trauma Service Program, Dr. Zubin Bhesania. Dr. Bhesania, thank you for joining us today.
Thanks for having me again.
Now, what type of injury is considered a traumatic injury?
Well, it's interesting. Everyone thinks of trauma as a big car accident where someone's hurt at, but in reality, the most simplest injury can be a trauma. So we have ground level falls as being our #1 trauma, actually, in the county.
Okay, so falls is the #1 cause of trauma that we
Sure.
see. There's also car accidents.
So everything else you think about. So we have car accidents, bicycle accidents. We have people riding horses that are thrown off their horse, people that trip and fall downstairs, people that roll out of bed and hit the ground. That's a trauma.
Now, are certain individuals more at risk for experiencing a traumatic injury?
Sure. In our geriatric population, our patients are a little more fragile, and a simple trauma can result in a significant injury. They tend to have osteoporosis, so we see broken hips, ribs, from a simple trauma. So a small little fall will cause those problems. Then we have people that have accidents. If they have higher risk lifestyles, if you drive a motorcycle, if you are physically active and have a mountain bike, you can sustain an accident which can cause a trauma.
Now, as a designated trauma center, what happens at the hospital when they learn that a trauma patient is en route?
Well, it's a very good question. What happens is, being a designated trauma center, we've gone through significant criteria to obtain that status. And so when we have a trauma activation, there's multiple people that are involved in the care of the patient. So we have the surgeons, obviously, that are aware of the trauma patient. We have the emergency room doctors. We have anesthesia available. We have nurse anesthetists that are all sort of drawn into the trauma to take care of that patient safely and quickly.
And the surgeons and all the personnel that you just mentioned, they're notified even before the patient arrives at the hospital, is that right?
Correct. So when EMS picks up a patient that's a trauma, they will radio head to the hospital to tell them about the patient, tell them about the injuries, to help rally the resources available for that patient.
Now, as the medical director of McLaren Port Huron's Trauma Services, what special training or certifications have you had?
Well, I have an interest in trauma, and what I wanted to do was increase the quality of care here. So I had to get some extra training in trauma itself, as well as going to a trauma director course to help facilitate the program.
And what are your responsibilities as the medical director?
Well, I get to review every single trauma that comes through the hospital. So myself and the nurse will review each case to see if cases were treated appropriately, if there's any improvement in the process of a patient, and we'll talk to the different departments, whether it's emergency room, radiology, lab, in order to improve the process. So we actually review every single trauma patient that comes through the hospital.
What are the benefits to the community of having a Level 3 trauma center?
It's huge. For the community, we have a designated trauma center, and so traumas are dealt with in an organized, systematic fashion that the American College of Surgeons sort of sets the guidelines on how to treat these patients. So what we've done is taken it away from regional areas of how to treat trauma, and we're following national guidelines. So we have outcomes that are better for our patients.
Now, it sounds like most trauma patients arrive to the hospital by ambulance, but are there instances where patients might drive themselves or be brought in by a family member?
Sure, we have issues where someone has a slip and fall, and the family will bring them in because they're complaining of a little neck pain, but we'll discover a broken leg or fracture in the leg somewhere else. So it happens that not everyone thinks it's a serious injury, and they'll bring it in by family, and we actually diagnose other problems.
Now, why is it important to call 911 if you think somebody around you has had a traumatic injury?
Well, when you call 911, you're starting to utilize resources, and so what happens is EMS will come out, the police may come out to help facilitate the patient to get to the hospital sooner.
Doctor, this has been great information. Do you have any closing comments for our viewers?
Well, I think it's real important to understand that being designated as a trauma center is a great thing for McLaren Port Huron, and we are the only trauma center in the county. And if there is a problem, a traumatic problem, you should really come here to get treated.
Thank you for joining us today.
Thanks.
Stay with us. We'll be back in just a minute.